Alright. So, actually, na-record ko na yung lecture. Unfortunately, no, hindi pa naka-on yung mic ko. So, take 2 tayo. Alright. Hi. So, welcome to the hydrotherapy lecture. Okay. So, we'll be tackling about the principles of hydrotherapy. Don't worry, we'll just cover the foundation, the basic ones, the principles, and basic applications. You'll be able to discuss this again next sem with your aquatic exercises under the Thera X1, no, with Sir Migs. All right, so let's start. Okay. So actually pala no, before I start, no, back natin ng konti. Now, this lecture came from MedBridge. No? So, I'm just going to discuss a little bit from here. And then later on, we'll just expand a little bit of yung mga hindi masyado na-discuss under this. Okay? So, for the introduction. Okay? So, water has several unique properties, making it a safe and effective treatment modality. No? So, we have two techniques, your immersion and non-immersion technique. Your immersion technique can be used for muscle strengthening, endurance, improving cardiac, respi, and renal function. It is also used for wound care and debridement. Although this part medyo mas naglilin na tayo recently sa non-immersion technique when it comes to wound care, because of the issues of contamination, risk of infection, kaya medyo mas naglilin na tayo sa non-immersion techniques. Okay? For the non-immersion techniques, in hydrotherapy, this can be used to cleanse and debride burns and diabetic, venous, and arterial wounds. Okay? So, pasensya na pag medyo paubo-ubo ako kasi I'm still under recovery pa from my mild COVID. So, kahit mild siya, medyo parang feeling mo severe pa rin siya. Sobrang disabling niya. So, historically, whirlpools have been used to debride necrotic tissue and wound debris. Okay? Rehydrate and soften the wound and improve circulation to the wound bed. Itong nasa picture dito, yan yung ating mga whirlpools. Your extremity tank and then your high boy. Later on, discuss natin yan. Babalikan natin yan. Dadaan natin ng very, very slight. Okay? Para lang medyo mas aware kayo. Because whirlpools, as of now, have, medyo hindi na siya ginagamit in clinics, Use of whirlpools has declined in recent decades due to the risk of infection. And actually, the APTA discouraged the use of whirlpools for this reason. Okay? So, hindi na siya masyado ginagamit. Very expensive din kasi, It's expensive, it's time-consuming, expensive in a way that after mo magamit yung water, syempre pupunuin mo yan, And napakadaming water niyan. For one patient lang yon. Syempre ayaw natin ng risk of infection. And then after that, pag itatapon mo na siya, hindi mo po pwedeng i-refill lang din ulit for the next patient. Kailangan mo na siya i-disinfect. Okay, so linisin mo pa siya. Alright, so medyo time-consuming and expensive to maintain siya. So, hindi talaga siya masyado nagagamit na. Okay? Now, let's talk about the physical properties of water. Physical properties of water. We actually have 5. Pero dito sa MedBridge, pinag-combine nila yung isang property. So, i-ano ko na lang siya, i-clear out ko na lang siya later on. So, first would be your buoyancy. Okay? First is your buoyancy. According to the Archimedes principle, an object in water experiences upward thrust. Upward thrust. Alright? Basta nakita niyo yung upward thrust sa water, that's your buoyancy. So, objects that are more dense than the water, they sink. Okay? But objects that are less dense than the water float. Okay? Yun yung niya. With this, no, applying it sa clinics, no, because of buoyancy, no, yung mga patients natin na hindi po pwede masyado ang mga weight-bearing exercises, like for example, your osteoarthritis, you wouldn't want to put much load usually sa knees ang affected, no? So, pagka nag-strengthening exercise ka, no, parang medyo limited kasi syempre hindi mo siya masyado po pwedeng pabuhatin ng mga mabibigat because it puts a lot of load on the knees and mas mag-worsen yung condition ni patient kapag ganon. So, with this one, putting the weight out of the formula, no, si patient, we put them in the hydrotherapy, no, para merong upward thrust, nababawasan yung no? Nababawasan yung tension dun sa affected joints ni patient. Okay? Ayan. And then, combined with that, no, is your resistance. Okay? Resistance, no? Which is related to the viscosity of water. And this can be used to strengthen muscles during immersion technique and debride bones during non-immersion technique. No? So, si patient, for example, meron siyang osteoarthritis, hindi siya po pwede masyado na sa mga weight-bearing exercises and you would want to incorporate strengthening exercises. You can make use of the resistance, no, as one of the physical property ng ating water. Okay, resistance, no. Pansin nyo, no, for example, di ba, pagka naglalakad kayo sa dalampasigan, di ba, or kaya pag low-level part na ng pool, di ba, when you try to run, it's harder to run, no? Pag nandun ka sa, yung sa malapit na sa paahon na kayo, no? Versus on the ground, diba? Pag tumatakbo ka, medyo mas mabilis. Alright? And that's what we call your resistance, no? Aside from that, no, you can also make use of the floatables to add further resistance, no? Kung sa ground, ang ating mga resistances would be your dumbbells, ankle weights, wrist weights, barbells, okay? Sa water naman would be the floatables, no? They add resistance because of the buoyancy, no? So, medyo kambal ang dalawang physical properties of water na ito. Alright? Ayan. Next. Oops. No, hydrostatic pressure naman. Okay? So, according to Pascal's law, no, fluid exerts pressure on all surfaces of an object in proportion to the depth of the object on the fluid, no. This can be used to treat edema by enhancing circulation, no. So, 'di ba ang problem kasi with our edema, there's too much pressure inside the vessel. Lesser pressure outside the vessel. So, ang tendency, nagli-leak yung fluid palabas. Okay, ng ating blood vessel, causing the edema. But, if we're going to increase the pressure outside the blood vessel, no, greater ang pressure outside the blood vessel rather than inside the blood vessel, then madi-decrease natin ang pag-leak ng fluid. And that's what happens here, no? Kaya, the deeper a person is, no, under the water, mas increase ang hydrostatic pressure. Okay? Ay, mas increase ang hydrostatic pressure. Therefore, madi-decrease ang edema. Okay? Kasi, lesser ang nagli-leak. And by that, we enhance the circulation. Kasi, nagsistay lang sila within the blood vessel. Okay? Ayan. Yung hydrostatic pressure na meron yung water, alright, nag-a-add siya, no? Counted siya as an outside pressure, okay, from the blood vessel, okay? Imagine niyo na lang, 'di ba, pagka sumisisid kayo, 'di ba, as you go deeper, parang mas may increased pressure kayong nararamdaman. That's what we call your hydrostatic pressure, okay? Ayan. Next would be the specific heat. Ito yung sinasabi ko sa inyo na kaya 4 lang yung na-discuss dito, no? Usually, sa ibang references, may kita nyo, 5 dapat yan. Dito kasi pinag-combine nila yung sa specific heat. Okay? So, i-move ko lang dun sa slide na dalawa. Okay? Na dalawa yung physical property ng water na binanggit. Okay? Alright. So, ito yung dapat dalawa siya, no? Your specific heat and your thermal conductivity. No? Both of them kasi talks about the heat transfer. Okay? So, kaya siguro pinag-isa sa MedBridge, no? However, no, medyo mas importante ma-discuss natin siya in detail, no? When we talk about the specific heat, no, sabi dito, 4 times that of the air, no? When we talk about specific heat of water, we talk about the ability to retain heat. Okay? And when compared to air, no, 4 times daw niyang mas kayang mag-retain ng heat. Okay? So, that's one property. Next would be the thermal conductivity. When we see thermal conductivity, it's more of heat transfer mismo. Okay? Mabilis mag-transfer ng heat. Okay? Than the air. Okay? It is 25 times that of the air. Kaya nga, di ba, pagka summer na, di ba, uso yung beach, no? Kasi sobrang init. Pagkatalon mo mismo dun sa body of water, no? Talagang mararamdaman mo yung nag-dissipate yung heat. Okay? Mararamdaman mo talagang, ay, presko, no? Ay, nawala yung init ng katawan. Alright? So, because, talagang mabilis ang conductivity pagkadating sa water, no? So, we have two modes of heat transfer when it comes to water. We have conduction, and we also have convection, no? So, pwede siyang mag-apply sa dalawang ito, no? If it's a stationary water, no? Stationary water, the heat transfer is by conduction. Okay? But if the water is moving, no? Ang heat transfer naman natin ay by convection. Ayan. Okay? Sige. So, balik tayo dun kay MedBridge. Okay, now let's talk about the physiological effects naman, okay, ng hydrotherapy ninyo. No? So, parang mali ata yung heading nila, no? So, physical properties pa rin kasi nakalagay. Pero dapat dyan, physiological effects na. No? First would be sa wound care, no? Wound debridement enhanced by the use of water as a cleanser and a solvent through both immersion and non-immersion techniques, no? Depende sa case, no, kung pang-immersion siya or pang non-immersion siya. No, pagka large areas of the body ang involved, no, ang kailangan na i-debride na wound na we make use of the immersion technique. Pero pag maliliit lang yung wounds, no, kunwari nasa extremities lang, tapos maliliit lang talaga, no, non-immersion techniques ang ni-utilize natin. Okay? Now, let's go on with the systems. Okay? Ano yung benefits of hydrotherapy per system? First would be sa musculoskeletal system. Now, as we have said earlier, no, immersion of the body in water decreases weight bearing on joints and along bones. So, this is very beneficial to patients who are somehow contraindicated with a lot of weight bearing, no? Or kaya naman sa mga patients na may difficulty in balance, no? Kasi this one, no, somehow wala yung fear of falls, no? So therefore they can do resistance trainings, resistance exercises here, okay? And the resistance offered by the water is used, no, for the strengthening itself, no? So, medyo, siya, mas makita or mas beneficial siya na sa ating aging adults. And also to athletes, no? Yung mga kakagaling lang ng surgery, hindi pa po pwedeng masyadong weight bearing yung na surgery na limb. So, yan. Pwede din sila. No? Ayan. Next. Cardiovascular system. Next would be the hydrostatic pressure from immersion in water, improves circulation and increases venous return to the heart. No? So, yun nga yung sinabi natin kanina, no? There is higher pressure outside the blood vessel. Therefore, mas nagsistay, alright, yung contents, no, nung blood vessel within it. Therefore, mas na-enhance natin yung circulation. And that results to increased cardiac volume, increased stroke volume, and by totality, no, you increase the cardiac output. Okay? And aside from this, no, aside from the blood volume itself, alright, the cardiovascular endurance is also improved. No? Syempre kasi pagka nag-strengthening exercise ka, it's not just the muscles working, right? It's also your ability to withstand fatigue, right? So, dito, mas na-enhance din natin ang ating cardiovascular endurance without triggering those individuals with exercise-induced asthma. No, meron iba, di ba, pagka masyado nang napapagod with exercise, nai-induce yung asthma nila. So, because there's high humidity with hydrotherapy, no, walang exercise-induced asthma. No? Kahit mag-exercise ka pa dyan ng buong magdamag. Okay? So, wala. No? Next would be your respiratory system. Hydrostatic pressure increases the work of breathing. Not only yung ating blood vessels ang somehow na-experience yung or somehow feels the hydrostatic pressure, but also the lungs, no? And because of that, there is an increased work of breathing, and this would act as if siya yung pang-exercise natin pagdating sa respiratory system. Siya yung magiging resistance natin, no? So, like for example, diba, si Miss Regine Velasquez Alcacid, diba? Dati daw, ang training ng tatay niya would be, kumakanta siya habang nakalublub sa drum. Siyempre, hanggang chest lang, no? Yan. Tapos, pinapakanta siya. Diba, pansin nyo din, pagka nasa pool kayo, once na lumusong na kayo, medyo mas hirap huminga. Okay? Pero syempre, breathable, kayang-kaya nyo pa rin siyang i-withstand, no, yung difficulty. But, you know, that's the resistance itself. And by that, no, somehow, nai-improve, no, ang strength and function of the respiratory system. Next, renal system, no? There is an increased renal blood flow causing the increased urine production and excretion of sodium. Okay, now I would want you to focus on this one kasi baka mamaya malito kayo. Okay, kasi this is a domino effect. Alright, water exercise can be used to treat peripheral edema as well as, no? Sa peripheral edema, it is because of the hydrostatic pressure. But in cases of hypertension related to hypervolemia, when we say hypervolemia, ibig sabihin, there's too much blood volume. Okay, there's too much blood volume. Kaya, tuloy, increased ang blood pressure mo, also known as your hypertension. Alright? And we would want to somehow decrease the blood volume. How do we do that? No? Syempre, you don't cause yourself to bleed, no? That's not the healthy solution. But the solution would be, eto, nabanggit na sa taas, no? With increased renal blood flow, we increase the urine production. Okay? And when we increase the urine production, ibig sabihin, mas marami kang inihi, okay, marami kang nilalabas, the blood volume decreases. Also, no, to add excretion of sodium. Okay, kung nasa ng sodium, okay, doon nagfa-follow si water. Alright? So, isa rin kasi yan, no, na nagkakos ng hypertension kapag ka you have a lot of sodium inside the body, because sodium attracts the water. So if there is an excretion of sodium, then that sodium also attracts the water to move outside the body. Okay? And with that, somehow, yung hypertension, ma-address natin siya. Okay? Lastly would be your psychological considerations. Water can be a comfortable and relaxing exercise medium that can offer the patient reassurance and confidence. Especially to patients na takot mahulog, fear of fall, kasi meron silang balance problems. Or kaya to patients who are afraid to weight bear because kakagaling lang siguro nila ng surgery and they think na baka masira nila yung nakabit na bakal or whatsoever. So the hydrotherapy would be the answer for them. Okay? Next. Alright, So therapeutic pool facility, the recommended water temperature is should be maintained at 92 degrees Fahrenheit. Okay? And the depth ranges from 3 to 4 feet. So we wouldn't want yung masyadong malalim kasi para maiwasan natin yung issues of drowning. Next would be the non-immersion techniques, for your wound care. Dahil nga medyo we wouldn't really recommend na the use of whirlpool, ito yung mga alternatives natin, okay? Which has a decreased risk of infection, like your spray bottles, bulb syringes, saline squeeze bottles, and your pulse lavage. Okay? Si pulse lavage, meron siyang high pressure. So, out of these 4, siya yung huling option natin. Kasi, when you use pulse lavage, medyo masyadong mataas yung pressure. Sometimes, pati yung healthy granulation tissue, sumasama. Alright? And we wouldn't really want that. Ang gusto lang natin tanggalin would be the scar formation. Yung brownish to blackish, thick covering of the wound. Kasi, di ba, tinatanggal yon para mas mag-heal ng maayos yung wound. Okay? So, yan. Burn wounds over large areas may need immersion techniques. So, yan nga yung nabanggit natin kanina. And a pressure of 4 to 15 psi is recommended to remove debris and microorganisms without causing damage to tissues. Okay. Alright? Again. Now, let's discuss the contraindications and precautions. Alright? Pag contraindication, one of which is your unstable cardiovascular condition because, di ba, isa sa benefit of your hydrotherapy is yung ability to somehow help your cardiovascular function well. But if your cardiovascular system is malfunctioning, pwedeng hindi siya mag-react ng maayos with the exposure to hydrotherapy. So, kaya siya contraindicated. We are expecting na bumaba ang blood pressure niya, pero yun pala mas lalong tumataas because of the unstable cardiovascular condition. So, merong mga ganong cases. So, pagka ganon, they are contraindicated, unfortunately, to the hydrotherapy. Next would be the impaired cognition or altered state of consciousness, because we are trying to avoid here issues of drowning, or kaya naman iumpog nila yung sarili nila dun sa iumpog nila or unintentionally mahit nila yung head doon sa corners ng ating pool, dun sa cement. So we wouldn't want that as well, so contraindicated sila. Next would be the bleeding or infection in the immersed body part and bowel or bladder incontinence, both of which would could cause contamination or risk of infection. Kaya bawal sila. Okay? And then, lastly would be the unstable seizure activity, just like your impaired cognition. No, we might have issues here with drowning or kaya them hurting themselves, no, by hitting their head doon sa sa corner ng pool. Alright? Next would be the precautions. Alright? Precautions naman, no, there's impaired sensation in immersed body part. Okay? So, hindi siya ganun ka, when we say precaution, it's 50-50. It depends on you if you would proceed or not. Yun ang precautions natin. Kumbaga, this is relatively contraindicated, no? It lies to your clinical decision making if you would continue or not. So, impaired sensation in immersed body part, 50-50 siya kasi somehow you can monitor naman the patient. You can monitor naman the temperature of the water. No? So, kung impaired yung kanya, you can check it for her. Diba? Next would be intoxication with drugs or alcohol. Okay, so same kasi siya with, somehow same siya with the altered state of consciousness. So, pwedeng ito yung mga medyo may drowsy side effects. So, yan, kailangan nila ng close monitoring as well. Next would be the prescription medications for hypertension. If you're going to remember, di ba, yung sa renal system physiological effect kanina, di ba? Due to the benefit na mayroong increased renal blood flow, causing the yung increased renal blood flow na yon would result to increased urine output, would result to somehow lowering the blood pressure. Okay? Plus, meron pa kayo netong prescription meds for hypertension. Ano bang ginagawa ng prescription meds for hypertension? Di to counter it. So, ibig sabihin, pro-hypotensive yung drug. So, if you have the renal system physiological effect plus the medication effect, then baka masobrahan naman ang hypotension ni patient, causing fainting and of course drowning, no, possibly. That's why kailangan dito 50-50, no. Siguro you could have the patient take the medication after na lang ng session ninyo, several hours after the session. Okay, so pwedeng ganon. Another precaution would be fear of water and then stable seizure activity, no? All of which would require close monitoring sa patient natin. Another precaution, no, maceration of the wound or body part to be treated. No, when we say maceration of the wound, no, sabihin masyadong nasasobrahan na sa moisture yung wound, which is not good, no? Which is not good for the recovery, no, wound na yon. Okay, so precaution yan. Wag na lang tagalan masyado, no, ang inyong hydrotherapy session. Recent skin grafting, no, this is 50-50 because if it's too recent, no, hindi pwede. Okay, siguro pwede na mga 1 to 2 weeks after the skin grafting. Okay? Or depende kung gaano ka naging intact na ba yung na-graft na skin. So, you would have to assess that and communicate with the physician as well. Okay? When using hot or cold water, consider the patient's ability to sense temperatures. Parang katulad lang din kanina. No? Ayan. So, for patients with complicated wounds or complex medical problems, always consult with the patient's physician before initiating care. No? So, ngayon pa lang, no, I would like you to be aware, no, that not all of the problems of the patient can be treated by a PT. Okay? So, kailangan yung maging competent when it comes to interdisciplinary approach. Okay? So, you should know your job, and then hayaan nyo na gawin din ng other allied health professionals yung kung ano yung dapat nilang gawin. That's why dito kailangan ng healthy and organized communication with the allied health professionals, no? So before initiating care, talk to the physician for clearance, no? Madalas clearance ang kailangan dyan, no? Especially pagka kakagaling niya lang sa skin grafting, no, yung mga ganon. Alright? I think this is the last part ng MedBridge. So, dun tayo sa, yung whirlpool. Dadaanan lang natin ng very, very slight. Okay, so we have different kinds of whirlpool. No? So, first we have the extremity tanks. No? So, these are for distal extremities. Low boy and high boy tanks. No? So, these are for the larger parts of the extremities naman. And for immersion up to the waist. No? Up to the waist. So, usually they are used for exercise, pain control in leg and foot, or the arm and hand. So, this is the comparison when it comes to measurements. So, you can try to pause the video, no? Para lang to take note of these measurements, no? Ayan. And then, let's just compare low boy versus your high boy. No? So, low boy, no, madali lang i-transfer yung patient dito. Kasi nga, shallow lang siya. So, ang pag-transfer mo, hindi mo masyado kailangan pang iangat yung pasyente. No? Because of the measurement of your low boy, no, kaya ni patient mag-assume ng long sitting position. And because of that, no, you can somehow make use of that to do ROM exercises. Okay? Pag high boy naman, no, medyo may kailangan ng medyo hassle ang transfer because kailangan mo talaga siyang iangat, no? Yan. Tapos, deep and shorter siya, no? So, ang position ni patient dito, nakaupo and then hip flex and knee flex. So, medyo limited ang ROM sa loob. So, ayan, no? Medyo mahirap siya. Alright? Mahirap gumalaw-galaw sa loob. Huwag na to. This is your high boy. No? Or kaya extremity tank. Magkapares kasi sila ng shape. No? Pero pag mas maliit, that's your extremity tank. Pag medyo mas malaki, that's your high boy. Okay. These are the common antibacterial agents, no? Yung pinaka ginagamit talaga na disinfectant for your whirlpool would be your povidone iodine or your betadine, no? Yan yung one of the most effective disinfectants for our whirlpool. Povidone iodine. Okay? Now, naisip nila, no, parang what if combine natin yung pros ng low boy tsaka high boy, no? So, naisip nila na magkaroon, naisip na nila yung Hubbard tank. Okay? So, this is a large whirlpool intended for full body immersion naman. No, yung kanina up to the waist lang kasi. So, this is used for debridement of burns. Di ba kanina, nabanggit natin, pagka large areas of the body ang concern natin, no, with wound care, ginagamitan na natin siya ng immersion technique. Okay? And this is where we put the patient, no? Hubbard tank. Because it's too big, you can also make the patient do her ROM exercises here. Right? So, this is your low boy. Okay. So, kaya ni patient mag-assume ng long sitting position dyan. This is your Hubbard tank. Okay, this is your extremity tank. Okay. Mukha naman siyang extremity tank. Maliit lang siya. Ayan. Ito, extremity tank. Yan, no? Sobrang liit lang niya. Compared to your Hubbard tank, no? Kasya yung tao. Alright. Your exercise pool, no, ito medyo modernized na ano na siya, equipment. Although, wala pa ako nakitang clinic dito sa Philippines. Although, meron siguro, hindi ko pa lang siguro nakikita. No, usually, sa athletes ito ginagamit, no? Or sa mga medyo mayaman, no? Meron silang exercise-induced asthma. Ito yung ginagamit nila, no? There's resistance after all when you do running, no? Habang nasa water. Okay? So, ayan siya. Next. I would recommend you to memorize this one. Kasi tinatanong siya sa board exam. Okay? Tinatanong po siya sa board exam. So, last time nung sa panahon ko pa, no, may natanong, mga 2 to 3 questions. So, baka makatulong sa inyo. So, bonus na agad, diba? Pagka alam niyo yung sagot dito. Ma'am, ano yung kailangan naming alamin dito? Yan mismo, no? Yung Celsius. Madalas Celsius ang tanong. Although, pwede silang lumipat sa Fahrenheit. Okay? Ayan. So, merong may mnemonic or may palatandaan kami dyan para makabisado natin siya. Okay? So, medyo inuubo ako, so baka medyo pumalya. Alright? So, but ito yung tono. Alright? Alam niyo yung song na Sumayaw Sumunod? Search nyo na lang. No? Yun yung tono nito. Okay? And nung exam, yun yung nakatulong sa akin itong kantang ito so that I could remember the never-ending numbers here. As you can see, no? Medyo overwhelming siya. Pero once you know the song, hindi na siya overwhelming at all. Okay? So, very cold 0 to 13, cold 13 to 18, cool 18 to 27, tepid 27, 33.5, neutral 33.5, 35.5, warm 35.5, 36.5, hot 36.5, to 40, very hot, 42, 46. Tan, tanan, tanan. Tapos, chorus agad, no? Tapos, ito lang babanggitin nyo yung nasa unahan. Kasi, medyo pare-parehas lang yung dito sa pangalawa. Okay? Pag naiba siya, doon nyo lang babanggitin. Ay, hindi. Pare-parehas pala talaga. Okay? 35, 55, 65, 82, 92, 96, 98, 104, 115, 35, 55, 65, 82, 92, 96, 98, 104, 115. Ayan. No? So, pagka nakabisado nyo yan, meron na agad kayo 3 points, no, sa board exam. No? Hindi ko naman sinasabing nire-recycle nila ng mismo ganong question. Pero yung mismo, it's not the same question, it's not the same case, no? Namomodify siya, syempre, no? Different case, but the question itself, no, somehow would ask these, no? So, yan. Kabisaduhin nyo siya. Malay nyo lumabas sa time nyo. Okay? Lastly, your contrast bath, no? This is used also for distal extremities and also for the genital area. Okay? So, si contrast bath, no? Ito yung alternating. Okay? Para daw ang somehow, ini-improve mo dito would be the response of dilating, constricting of the blood vessels. Okay? Especially yung mga, ischemic parts of the body. Okay? So, ano daw siya? Ito, you alternately immerse the body part sa warm and then sa cold water. Okay? And you always end up in warm dapat. No? Ang ending dapat warm. So, ang ratio niya, 3:1. Ibig sabihin, 3 minutes warm, 1 minute cold. Okay? 3 minutes warm, 1 minute cold. And then, dapat mag-end up siya with warm. Duration is up to 15 minutes. Okay? So, yun, no? That would be it for our hydrotherapy lecture. Thank you.